Frovatriptan is a 5-HT1B/1D receptor agonist used to treat migraines. In this video, let's found. What is Frovatriptan? What is Frovatriptan used for? Contraindication. What are the side effects of taking Frovatriptan? How does Frovatriptan work? How to use Frovatriptan? What is Frovatriptan? Frovatriptan, sold under the brand name Frova, is a triptan drug developed by Vernalis for the treatment of migraine headaches and for short-term prevention of menstrual migraine. The product is licensed to Endo Pharmaceuticals in North America and Menarini in Europe. What is Frovatriptan used for? For the acute treatment of migraine attacks, with or without aura in adults. Contraindication. Frovatriptan should not be given to patients with ischemic heart disease, cerebrovascular syndrome, peripheral vascular disease, uncontrolled hypertension, hemiplegic or basilar migraine. Side effects. Rare but serious cardiac events have been reported in patients with risk factors predictive of CAD. These include coronary artery vasospasm, transient myocardial ischemia, myocardial infarction, ventricular tachycardia, and ventricular fibrillation. Pharmacodynamic. Frovatriptan is a second-generation triptan 5-HT receptor agonist that binds with high affinity for 5-HT1B and 5-HT1D receptors. It is structurally distinct from, but pharmacologically related to other selective 5-HT1B/1 receptor agonists. Frovatriptan has no significant effects on GABA-mediated channel activity and has no significant affinity for benzodiazepine binding sites. Frovatriptan is believed to act on extracerebral, intracranial arteries and to inhibit excessive dilation of these vessels in migraine. Research that migraine can be caused by the swelling of blood vessels around the brain. Frovatriptan eases the pain associated with migraine by narrowing these blood vessels. Frovatriptan has one of the highest affinities for the 5-HT1B of the second-generation triptan agonist. Mechanism of action. 3 distinct pharmacological actions have been implicated in the anti-migraine effect of the triptans. 1. Stimulation of presynaptic 5-HT1D receptors, which serves to inhibit both dural vasodilation and inflammation. 2. Direct inhibition of trigeminal nuclei cell excitability via 5-HT1B/1D receptor agonism in the brainstem and 3. Vasoconstriction of meningeal, dural, cerebral or pial vessels as a result of vascular 5-HT1B receptor agonism. Half-life. 26 hours. Dose. Migraine. Indicated for acute treatment of migraine headache. 2.5 mg PO at onset, may repeat after 2 hours if migraine recurs, not to exceed 7.5 mg per day. No evidence that a second dose is effective if no response seen with first dose for same headache. Safety and efficacy for treating more than 4 migraine attacks in 30-day period not established. Safety advice. FDA pregnancy category C risk cannot be ruled out. That's all the information about Frovatriptan we collected. Thanks for listening. Do not forget to like, share, and subscribe for the HeInfo channel if you like this video to update more health information.